I'm Caroline. I'm an Engagement and Insight Officer with Healthwatch Northumberland, and we're here today in Ashington at Age UK at the Roundhouse to talk to people about hearing loss. So we want to hear about what people think about the hearing loss services in their area and how we can maybe improve them. So we're here just to try and talk to people and get their views.
I'm David Thompson, and I'm chair of Healthwatch Northumberland. It's a position which really interested me from day one and still does, because it's about people. It's about the voice of the people, and Healthwatch presents an independent perspective on what people are thinking, the preferences they have for health and social care. And I'd like to think that the voice of the people really does count by various means within the county, and one of the means whereby people's voice can be heard by the providers and the commissioners is Healthwatch Northumberland, and long may that continue, because communication and engagement with the community is of paramount importance, especially in these days when people need to be involved much more in their own health and social care.
Coming out to different communities and hearing what's going on is really helpful, because after all, Healthwatch is part of a national network, and it means that what we gather, what we hear and what people tell us doesn't just affect change in this area, it can also affect change across the rest of England and the rest of the NHS as well. So it's really important that people say, oh well, that was my experience, does it really matter, does it really change anything? I would say yes, it does, because it all adds up in the end. And I think when you look at some of the things that have happened within Northumberland, some of the changes that have gone on recently, some of the new services that are starting up, all of those things have had input from local communities and will continue to have as they go on. And those things are some of those things are going to be looked at nationally as examples of really good practice. So what we do here in Northumberland is actually quite important for the rest of the country as well.